Hi everybody, Dr. Tony DelAngel here, and I'm here with our expert of the month, Dr. Doug Slaughter from Land of Enchantment Spine Surgery. I just want to welcome you to the set here, and thank you for coming by. I want to introduce you to all of our patients, and at the very end, I'd just like you to give all your information so that way you can kind of share. If anybody has any questions for you, we can relay that to them. But why don't you just tell us a little bit more about yourself?
Sure thing. First, I want to thank you for inviting me to be your expert of the month. I am from Columbus, Ohio, originally. I did my undergraduate training at Ohio State University and then medical school training at University of Cincinnati. I trained in orthopedics at the Maricopa Medical Center in Phoenix, Arizona, and then I transferred up to the Beth Israel Spine Institute in New York City and did my spinal reconstructive training.
Oh, wow. Okay.
I've been in practice since 2001. I practiced in Phoenix, Arizona, and then I moved my practice here to Albuquerque in 2010.
Wow. So you've been around for a while.
Been around for a while.
Okay. Well, why don't you tell us a little bit more about the most common candidate for spine surgery?
Sure. Some of the most common things any spine surgeon sees are lumbar disc herniations, some cervical disc herniations, and in our older population we see a lot of degenerative changes causing pinching of the nerves, which is called spinal stenosis.
Okay, so. Very good. And you know, we have a lot of those patients here, and so sometimes chiropractic may not be able to help, or any other service. So some of our patients, they work, they have other issues going on, but they may need a surgery. What would you say the expected recovery time would be in some of the types of surgeries that you deal with?
So the ones that are most common, the discectomies of the lumbar spine, the laminectomy, which is opening up the space for the nerves in the lumbar spine, those surgeries patients recover from unbelievably quickly, especially when we do them in a minimally invasive manner like I do at Land of Enchantment Spine Surgery. Most of those patients are taken care of as outpatient or overnight stay surgeries, and they're recovering from the incision in their back, which is usually about an inch long. The nerve recovery, as you know, is going to take the longest because nerves take a long time to recover, but the incision, people can get back to work. I've had people have surgery on Friday and they're back to work on Monday. If they're executives, if they're hard laborers, we're going to keep them out a little bit longer because we don't want them to injure their back. But most of the time, it's usually within about 2 to 4 weeks that they're back at work full duty.
I'm glad you actually brought that up, because sometimes patients think that spine surgery requires they're opening up their whole back, and it's a very aggressive approach. But could you kind of touch a little bit more about it's actually minimally invasive nowadays?
I do a lot of minimally invasive surgery. I've been teaching minimally invasive surgery since about 2002, 2003. I've taught many surgeons around the country, mainly in the Southwest, but I've gone up to Oregon, Seattle, California, and taught these courses, and actually I've been to Denver recently and taught surgeons how to do some minimally invasive techniques, not only lumbar disc herniation surgery, which is, for patients that know metric system, 18 millimeter incision, which is pretty small. I know that everyone is now looking into the laser spine surgery and endoscopic surgery, which I'm trained in, but no hospital here has the equipment. That's about a 7 millimeter incision. These are unbelievably small incisions, and people are going into the hospital, having surgery, and going home. They're not staying in hospital at all. For lumbar laminectomies, there are some insurances that require the patient to stay in hospital overnight. So, but that's still a 2/3 of an incision. 2/3 of an inch long incision instead of the open the patient's back from stem to stern.
Sure, sure. And you do stuff with cosmetic surgery. We have a lot of patients who have a pretty significant scoliosis. Is there anything that you can talk about in that sense?
So I'm trained, when I trained at Beth Israel Spine Institute in New York, that was a training in what we call complex spine surgery, which is scoliosis and that kyphosis, which is the leaning forward that patients get concerned about. And I'm trained in how to fix that, and I enjoy those surgeries immensely. Those are longer surgeries that they're not typically done through minimally invasive technique, although I'm starting to marry those techniques together. to do more minimally invasive surgery even in those. The recovery time for those surgeries are quite a bit longer and can be up to 15 months full recovery to get back to your energy levels and all those type of things that we expect to be able to get around and do things we want to do without being fatigued.
Sure, okay. Well, a lot of our patients have already had a spine surgery.
Yes.
What would you recommend for them if they're still having a residual pain after the surgery?
So I used to give lectures in Phoenix when I practiced there on what we call failed backs. And those are patients that continue to have pain, either the same pain that they had before surgery or have a new pain that they didn't have before their surgery. And some of the main reasons that people continue to have pain after their surgery, especially if it's the same pain that they had before, is because we as surgeons misdiagnosed them or we performed the wrong surgery for their particular pathology. More recently I've been looking at other areas or causes of pain, and we have found that there are a bunch of spine surgeons in the United States that have found that the sacroiliac joint is a significant cause or generator of pain. And a lot of patients that have had a perfect spinal fusion in the lower lumbar spine, the surgery went great, but now they have pain that's still in their buttock, and they're equating that to low back pain. And oftentimes it's related to the sacroiliac joint now taking up the stress of that level that is fused.
Sure.
So fusing that level or sometimes doing injections of that level will eliminate that pain or at least significantly decrease it. So having another evaluation by a spine surgeon is, I think, very important. And sometimes we have to think outside the box. The films sometimes show us, oh, there's a degenerative disc at one level, but you have to really do that examination that my instructors always tell me. You can't diagnose someone just by looking at films.
Sure. Sure. Okay, well, just so that way all of our patients know, I send all of my patients who maybe have not benefited from chiropractic care or physical therapy or any of the other therapies that we have in the office, I send them to Dr. Slaughter specifically for any type of spine issue. So, Dr. Slaughter, if you could let our patients know just some contact information. If anybody has a specific question about their condition, could you let them know just where to reach you and anything else you'd like to add?
So I want to thank you for sending patients. We send patients to you as well. So this is a collaborative effort to try and get you better as a patient. But our office is right off of Coors, off of La Aria. It's the office's address is 3620 Bosque Plaza Lane, Northwest. And we're in Suite B. We're actually the only office in the building at the present time. Our office number and the way you can get in touch with us by phone number is 505-792-6886. And then we also have a website, which is landovenchantmentspinesurgery.com, I do believe. And there's some contact information there as well.
Okay. Well, there you have it, folks. This is our Expert of the Month for February, Dr. Doug Slaughter. If you have any specific questions, I'll leave all the information at the very end of this video. Until then, we thank you for viewing in.
Thank you.